I'm Ira. We are here with Dr. Wu Pang Hung. Dr. Wu is an adjunct assist professor in NUS, and we are here with him in his private practice in Mount Elizabeth Orchard. Hello, Dr. Wu. Thank you so much for having me here today. Dr. Wu, there are different types of back pain, right?
Or the back pain can be divided in several regions. It can be located centrally in the back. It can be located in the buttock, or it can go down and radiates down to the leg. In terms of back pain in the back, it can be caused by the disc. Typically, those pain, the patient feel bad about bending forward. And then they have pain in the facet joint, which is the joint at the back, and then they feel pain when bending backwards. I think it's important to find out that the nature of the pain as well. It can be caused by a fracture, a tumor, an infection, or just most of the time degenerative cases, such as wearing out of the disc, prolapse of the disc, herniation.
What caused the back pain? What kind of investigation do you need to do?
Typically, a best investigation is have a good history taking with the doctor and do a clear clinical examination. Based on that, the doctor typically order X-ray. The X-ray can be done in static, meaning anterior, posterior, or just front, back, or at the lateral. It can also be a dynamic X-ray where we ask the patient to bend forward and backward so that we can see how the spine moves in those X-rays.
What kind of spine problems that we need to urgently seek treatment for?
Some of the red flags we call in spine is tumor, infection, and fractures, okay, due to trauma. So this patient typically presents with weakness or numbness of the leg, severe back pain that is not remitting despite painkillers, or worse, back pain at night. Sometimes they have bladder and bowel symptoms. These are very serious conditions that need to see doctor very early and urgently.
What kind of bladder and bowel symptoms?
So it can just range from difficulty in controlling the urine or the passing motion. If they are not passing urine or motion as per normal and is associated with a back pain, there can be underlying serious spine problem.
So what kind of treatment would you recommend for patients?
So the treatment options can ranges from the first, a conservative treatment, which is a proper diagnosis, and then medications and physiotherapy. We typically, for those non-urgent cases, treat that for a few weeks and then assess the patient again. If the patient's pain got worse or get more serious, or the conservative treatment just is not working and disturbing their life, the next level of treatment can be that of the injection or endoscopic spine surgery, or that of the surgery. That can be discussed accordingly with the doctors.
If surgery is necessary, what options do they have to do the surgery?
There are a few types of spine surgery. One is to decompress the nerve that is being pressed upon. Second group is stabilization of spine and fusing the spine because it's becoming unstable. The third group of surgery is by just instrumenting the spine to secure a fracture. And finally, there are surgeries that's performed to relieve the pain due to degeneration of the disc or that of the facet joint. So these conditions, treatment options can be delivered through an open surgery, a minimally invasive surgery, or in the current status, ultra minimally invasive called endoscopic spine surgery. Endoscopic spine surgery have evolved. So in the latest version, which I'm practicing now, we have decompressed the cervical spine, the upper back, as well as using endoscope to instrument and fuse the spine. We call it endoscopic fusion. So in general, endoscopic surgery has, in my practice, replaced 80% of what typically I do with an open surgery. Being an ultra minimally invasive spine surgery, decrease infection risks, shorten the length of stay for hospital, less blood loss, and as a result, early return to work and return back to the activities. One of the key highlights of endoscopy, it can also reach some of the difficult places in spine without causing too much removal of the bone and the ligament that may actually causing problem with stable spine. Sometimes we offer to put screws to fuse the bone when the one of the nerve is compression around here. So in endoscopy, we can assess this region by putting the scope directly at around the region that is compressing on the nerve, and then trim those bone that's next to the nerve, so that the nerve will become free without disrupting too much of the joint, so that we can avoid fusion. 80 to 90% of my cases are walking home within 23 hours. They will be starting the physiotherapy, quite an accelerated program, about 2 to 6 weeks. And we are expecting the patient to return to normal activities typically around 3 months. There is a skin wound of usually 7 mm to a cm. I personally usually do not need to close the skin wound with stitches. So in that way, the patient look after themselves by actually just maintaining the plaster that is on the back without getting it wet. And 2 weeks later, then we will take out the plaster. Number one, keep the body weight in check so that do not overload the spine joints. Right. Second is to keep the muscle strong around the core muscle, abdominal muscle and the back muscle. Keep it strong so that it can support the spine better. Smoking is a big no-no in spine. They can cause degeneration of the disc and can cause more problems in the back. Do adjust your ergonomics. A lot of us are sitting down more, a lot of us are bending our neck more. So try to have a wider TV at the level of your neck, so that you do not always bend down and look at the tablets. Try to have an arm support that is at the appropriate level, so that your arm is rested, so that you don't strain the neck. And then have a good posture of sitting. Some of these things can help in long run to prevent spine problems.
Okay. Thank you so much, Dr. Wu, for your time. And it's great to hear that there's hope for people who are not able to go under general anesthesia but still have a very painful back pain. We hope this video will help the public to be aware that there are options that you can choose when you have back pain.